You see blood in your semen and immediately panic sets in. Is this serious? Should you rush to the emergency room? I'm Dr. Anim, and today on Health Made Simple, we're talking about haematospermia blood in semen. I'll explain what causes it, when to worry, and what the evidence actually says about this alarming but often harmless condition. Haematospermia, also called haemaspermia, is simply the presence of blood in your semen. It can be bright red, brown, or just a little pink. Now, here's the first thing you need to know. While it's visually shocking, studies show that in about 85 to 90% of men under 40, it's benign and resolves on its own. But understanding when it's harmless versus when it needs a closer look can save you a lot of worry or, conversely, catch something serious early. So let's break this down. Haematospermia is actually more common than you might think, but it's underreported because many men don't seek medical care. Most cases happen in men between 30 and 40, but it can occur at any age. What's thus reassuring is that a systematic review found cancer was the cause in less than 4% of cases, almost exclusively in men over 40 with persistent symptoms. To understand why this happens, you need to know where semen comes from. It's a mix of fluids from the seminal vesicles, the prostate gland, and other structures. Blood can enter at any point along this pathway. Most often, the blood comes from the prostate or seminal vesicles, usually from inflammation or minor trauma. Think of it like a nosebleed. Any irritation can cause tiny blood vessels to leak. Let's get to the causes. The most common benign ones are inflammation like prostatitis, minor trauma from vigorous sexual activity or even a long period of abstinence, and recent medical procedures like a prostate biopsy. In fact, after a prostate biopsy, up to 80% of men will have blood in their semen. Sometimes no cause is found at all, and it just goes away on its own. Now, for the less common but serious causes. These include prostate cancer, though this is rare, especially in younger men. Other causes could be tumors, vascular abnormalities, bleeding disorders, or even some sexually transmitted infections. This is why knowing the red flags is so important. So, when should you actually worry? The evidence gives us clear signals. See a doctor if you are over 40 years old, as age is the biggest risk factor for more serious issues. Also, see a doctor if the blood is persistent or keeps coming back, or if you have other symptoms like pelvic pain, painful urination, or unexplained weight loss. For men under 40 with a single episode and no other symptoms, observation is usually fine. But when in doubt, get it checked out. If you do see a doctor, they'll start with a thorough history and a physical exam. First-line tests usually include a urinalysis, STI screening if needed, and a PSA test for men over 40. Depending on your risk factors, they might suggest advanced imaging like a transrectal ultrasound or an MRI. Treatment depends entirely on the cause. For most cases where no cause is found, the best treatment is just time and reassurance. If an infection is the culprit, antibiotics will clear it up. If a more serious issue like cancer is found, treatment will follow specific protocols for that condition. The good news is that the prognosis is excellent in the vast majority of cases, with 80 to 90% of men finding it resolves on its own within 1 to 2 months. While you're waiting for it to resolve, you can avoid vigorous sexual activity, stay hydrated, and practice safe sex. If you're over 40, keep up with your regular prostate health screenings. So the bottom line on haematospermia, it's scary, but for most men, especially those under 40, it's harmless and temporary. Know the red flags, understand the evidence, and talk to your doctor when you need to. If you found this helpful, please like, subscribe, and share it with someone who might benefit. And drop a comment, what health topic should I simplify next? I'm Dr. Anim, and this has been Health Made Simple. Stay informed, stay healthy, and I'll see you in the next video.